Greetings, this is Group 10, and we will be presenting the health and wellness promotion of immunizations in the American Indian and Native Alaskan population. My name is Lauryn Hill.
I'm Deashia Crayton.
I'm Edwin Lang.
I'm Noah Grace.
I'm Alina Stevens.
I'm Azeezat Rasaki. I'm Jaelyn Benyard.
And I'm J.R. Whitaker.
Hello, and now we're going to discuss the description of population and assigned area. The target area and population targets the parents and children of the American Indian and Native Alaskan population. Zip code 86045. The American Indian and Alaskan population only represent 1.5% of the total U.S. population. It's a growing population with only 1/3 of the people younger than 18 years old and fertility rates that exceed those of other groups. More than 1/4 of the American Indian population is living in poverty, a rate that is more than double of the general population of 40%. Educational and economic status, let's discuss that. Educational discrepancies are present within this population. Those that possess a high school diploma or GED only represents 71% versus 80%. Or they only possess the bachelor's degree of 11.5%. This in turn results in a low labor force participation. Family unemployment rates range from 14.4 to 35. The poverty and unemployment are related to economic development challenges, including geographic isolation and availability to the low-wage jobs. Lastly, the American Indian and Native population are also subject to violent and traumatic events. This in turn results in serious injury and mental health disorders.
First, we're going to start off by discussing the table shown in the presentation. The table to the left gives information on immunization coverage and exemptions for kindergartners for the 2018-2019 school year. The table shows that there are a percentage of kindergartners who have still not been vaccinated due to religious reasons. The table to the right shows the kindergartners between 2015 and 2016 school year. The numbers have not drastically increased between the 2 years. The table to the right also breaks down the different exemptions and the different vaccines that they're exempt for.
Going off of the information in the charts, the students that were exempt from the immunizations based on personal beliefs have accounted for around 5% of the students in public schools and 13% for students in charter schools. These vaccination exemptions include DTaP, polio, MMR, hepatitis B, and the varicella vaccine. The data shows that after a gradual rise in exemption from one or more vaccines in 2015 through 2018, exemption rates are slowly dropping back under 5%, indicating that more children are becoming vaccinated.
Okay, so death rates for adults according to the Indian Health Service exceeds the general population by 40%. Contributors to that percentage are chronic diseases such as diabetes, chronic liver disease, and cirrhosis. On top of these disease states, adults as well as children are dying from infections that can be prevented from immunizations, such as tuberculosis, pneumonia, and influenza. In regards to children, specifically neonatal death rates compared to other U.S. races and Caucasians are 2 times greater, and children between the ages of 1 and 4 have a death rate 3 times higher than children of that of the general population. Individuals with both chronic diseases and infectious diseases, for example, diabetes and influenza, have an increased chance of hospitalization and death. Therefore, a program to get individuals immunized can decrease death rates in the total population.
Immunizations are important because they help protect individuals from infectious diseases like influenza, mumps, and measles. Expanding access to immunizations is crucial to achieving sustainable development goals, which are a blueprint to achieve a better and more sustainable future for all. Immunizations have a big impact on the community. They decrease communicable diseases that used to kill people before the age of 20. They reduce morbidity, mortality, and reduce direct and indirect medical costs. Since 1924, the U.S. vaccines have prevented 40 million cases of diphtheria, 30 million cases of measles, and 130 million childhood diseases. Per the World Health Organization, today vaccines have prevented 2.5 million deaths per year. Immunizations are a serious topic. They play a big role in eliminating and reducing the impact of childhood diseases. More than 1 million infants and young children all over the world die every year from rotavirus, diarrhea, and pneumococcal disease. When children don't get vaccinated, they have the potential to have firsthand experience of the infectious disease. In 2017, the World Health Organization reported a measles outbreak because multiple countries experienced severe outbreaks of the preventable disease. This outbreak was due to gaps in vaccination coverage.
The goal of our program is to educate parents, especially mothers, on the importance of vaccinations and to increase the percentage of fully immunized children in the American Indian and Native Alaska population from 68.5% to greater than or equal to the percentage of their non-Hispanic white counterparts, which is 72.2%. Resources that are recommended by the CDC guidelines on immunizations include parent-friendly schedules for children of different age ranges. On the left, there's a schedule from birth to 6 years old, and on the right, there's a schedule from 7 to 18 years old. Next, the CDC also has a video on the journey of children's vaccines. This can be used to emphasize and educate on the safety and importance of children receiving their vaccinations, in order to ensure and protect their health and the health of those around them. Lastly, other resources offered by the CDC that can help improve the health of this population are instructions on vaccine administration, vaccine safety information for healthcare providers, vaccine catch-up guidance, vaccines for travelers, and even the names of vaccines in different languages.
There are many concerns with parents regarding vaccinations. Specific concerns in patients with vaccinations include adverse reactions. Sometimes children may have mild pain, mild fever, or redness at the injection site. Vaccination scheduling is also a concern. Is it important to adhere to? Lastly, a patient's immune system can also be affected due to the vaccine using small amounts of antigens to help the children's immune system recognize and learn serious diseases. The percentage of fully immune children is 68.5%. In 2017, the amount of students in Coconino County who were not vaccinated accounted for roughly 8%, and 5% of public school students weren't vaccinated due to personal beliefs.
Our program involves setting up tables outside of grocery stores and local neighborhood hotspots with the pharmacist present. The role of the pharmacist is to educate the community on the proper vaccine times, as well as to disconstruct myths about getting your children vaccinated. The tables will play tablets of a video entitled The Journey of Children's Vaccine, as well as have copies of immunization schedules to be handed out to both parents and children. In Cosino, Florida, there are 7 Walmarts, 9 Walgreens, and 8 CVS's, as well as 4 major parks that are common to parents and children. In Cochino County, there's a city called Flagstaff, and 12% of the residents there walk or hike to work every day. So setting up tables outside in the community is a great way to reach a majority of the people. That's the only way that our program will work.